Hello everyone. This is Dr. Rishikesh Malonkar. I am a practicing gastroenterologist in Mumbai. So today we will be discussing regarding a very prominent topic, that is gastroesophageal reflux disease, that is GERD. GERD is nothing but the reflux of gastrointestinal content inside the esophagus. So it is a very common disorder. It has various presentations, most common being the epigastric burning, heartburn, epigastric fullness can be there. Other uncommon symptoms or atypical symptoms that can in the form of chest pain or throat irritation or chronic cough, which it can present like that. So diagnosing the disease is very much important. If particular person is getting this kind of symptoms twice a week, so it is a significant symptoms it is there. So we need to evaluate. So what are the various factors which are causing this reflux disease? So most common being the overeating and the overweight is most common etiological factor. Then there are multiple medications in the form of NSAIDs which can lead to hypersecretion and acidity. Then if particular patient is having other comorbidities in the form of some gut motility disorders in which the food is not getting passed into the small intestine, which is known as gastroparesis can be there, which can cause stagnation of the food and can lead to reflux disease. This reflux, when it is diagnosed early, can be treated with effective medications, but there are various complications for that reflux disease are there. So most common being the esophagitis. Esophagitis is nothing but there is swelling or inflammation in the food pipe. This esophagitis is the initial complaint. Once this particular thing is treated, the further complication can be prevented. But if this symptoms persist for longer time, this esophagitis then turns into something called as ulcerations and strictures. Stricture is the narrowing of the food pipe, which can lead to difficulty in swallowing, dysphagia and nutritional decrement can be there. So there further complication, there is something called as Barrett's esophagus. It is a precancerous condition. We need to diagnose it early, and then later being the most dangerous being the esophageal malignancy or cancer can be there. So how can we prevent this GERD? How can we just modify our lifestyle and way? So first and most important being the early dinner timing should be there. There should be at least 2 to 3 hours gap should be between the bedtime and your dinner timing. Then there will be a overall reduction in the weight, that is 10 to 15% of the body weight should be reduced to reduce the reflux. Then further we can have our head elevation during head elevation at our bed during the bedtime at night. Late night dinner, late night snacks, heavy meals should be avoided. Spicy food and other things should be avoided. These are the lifestyle modification we can follow. This particular thing needs to be evaluated first. If patient is getting particular symptoms, trial of medication for in the form of proton pump inhibitors, newer molecules in the form of vonoprazan and all. Other antacid medication should be given for 1 or 2 weeks. If still persistent symptoms are there, the patient should be evaluated in the form of direct. We can go for the upper GI scopy, which can determine the severity and identify the various complications and the duration of the treatment required. So it is a very benign disorder in the early stages but can cause various serious complications. So identifying the symptoms in the early stages and diagnose and treating the particular GERD is very much important, because it can affect your daily lifestyle, it can decrease your productivity and it can cause further complications if not treated in proper ways. Okay? Thank you.